So good afternoon to everybody. Greetings from Forts. We welcome all the participants to this public awareness webinar on breast and gynec cancer, a much needed topic for every woman. We thank Rotary Club of Adayar and Chennai Specialty Clinic for giving us an opportunity for conducting this webinar for the general public. Forts is in the pharma industry for the past 44 years, following the motto of innovating for good health. We from Forts have innovative products in gynecology like Ubica Rumen, Prenatal, Argin, and KMAC. At present, we are exporting our products to over 50 countries around the world. We welcome today's speaker, Dr. Meera Ragavan. She is a senior consultant Uro-Gynecologist and robotic surgeon from Apollo Hospitals, Chennai, since 2012. Dr. Meera Ragavan worked as a consultant in Obs-Gyne at the leading university teaching hospital in United Kingdom for 5 years. She is an MRCOG trainer and an examiner. She is also a faculty at Ethicon. She is a winner of 32 gold medals, including the prestigious Johnston gold medal from Madras Medical College for the best outgoing students in undergraduate course. Moreover, Dr. Meera Ragavan was the best resident in Obs-Gyne in 1999 from PGI Chandigarh. Madam has many publications and articles to her credit in scientific peer-reviewed journals, newspapers, and magazines. With this short introduction, it's our pleasure, ma'am. I hand over the session to Dr. Meera Ragavan for further proceedings.
Thank you for the kind introduction. Hope I'm audible and
Yes,
visible.
ma'am. Yes, ma'am. Yes, ma'am.
Thank you. Good afternoon, everyone. This month being Breast Cancer Awareness Month, as well as the last month was for creation of awareness about women-related cancers. We thought it will be only appropriate to give people awareness about the most common cancers which happen in women, namely breast cancer, uterine cancer, cervical cancer, ovarian cancer, so on and so forth. I'm not going to dwell into the medical intricacies of that, but I'm going to lay it out simply as who are at risk, how you should get screened, how you can prevent it in the first place, how to detect it early, what are the possible ways you can prolong survival, and whom should take advice at appropriate times. So this will be more of an awareness about the protective strategies and the preventive strategies. We need to engage ourselves in the prevention of the battle against women-related cancer. I'm going to share the screen. Just confirm that you're able to see the PowerPoint as well.
Yeah, ma'am. Visible, ma'am.
Okay. So I'm going to the slideshow mode. Is it in the PowerPoint slideshow mode?
Yeah, ma'am. Yeah, ma'am.
Yeah, okay, fine. And please confirm it's moving as I move the slides as well.
Yes, ma'am. Yes,
so the first slide, which I'm going to show is breast and ovarian cancer. This is the global cancer registry, which is showing the prevalence of all cancers in 2018, which are new cases in females worldwide, all ages. As you can see from the pie diagram, the majority, which is the pink, is definitely breast cancers. Other cancers do constitute nearly a third, but 1/4 of the patients who are detected as new cancers among women worldwide, irrespective of age, is breast cancer. To that, next comes colorectal cancers, lung cancers. Thankfully, cancer cervix is on the decline. That is because of the screening programs worldwide, especially in the Western population. However, in India, second only to breast cancer is cervical cancer still, because we do not have robust screening programs for detection of cervical cancer yet in India, though the FOGSI, which is the National Committee, has given clear-cut guidelines. It is up to the women themselves as well as primary healthcare professionals who need to emphasize this aspect of improving the screening protocol for women with cervical cancer. This is about India. As I rightly said earlier, breast cancer, about 27% of the new cases are breast cancer. Next to it is cervical cancer, and then ovarian cancer. So in females, the breast and the gynecological cancers top the list as far as cancer prevalence is concerned, which is why today's topic has been chosen. So what are the risk factors for breast cancer? Increasing age, especially menopausal. But in India, we find that there is a shift towards the earlier age group as far as the breast cancer incidence is concerned. The youngest I have seen with the breast cancer is 21. And normally in the West, we see it around 60 and 70. Here it is more or less 45 to 55. So that's a slightly different age group which we see in India. Premenopausal cancers are also high-risk cancers which we see. There can be a genetic influence on the cancers, and lifestyle changes have to be made because those are known to increase the risk of breast cancer. So is a family history of breast cancer. Regarding ovarian cancer, there is an increased risk if there is a family history of breast, ovary, or colonic cancer, genetic aberrations, increasing postmenopausal age. Whenever the woman has got pregnant or multiple pregnancies, whenever the woman has breastfed, the use of oral contraceptive pills have all decreased the age or decreased the risk of ovarian cancer. So how do we screen for breast cancer screening? Best would be breast self-examination. I'm going to go through this picture systematically so that everyone understand how to do a proper self-breast examination. First of all, do not feel shy, do not feel scared, do not feel inhibited. It's the only person who is able to detect anything abnormal would be a person who knows what is normal. So unless you self-breast examine, there's no way you can know what is normal. So have a specific day in a month, 2 to 3 days after the period. Examine the breast and the armpit with a raised arm. Use the fingertips with massage oil or shower gel and have an up and down method of examination. Use circles and examine the breast in a mirror for lumps or skin dimpling and change in the skin color or texture, any nipple deformation, pulling of the nipple to one side, color change, discharge, or any fluid leakage. All reproductive age group women will have to undergo self-breast examination. Ultrasound is usually recommended for women above the age of 30, less than the age of 40, at any time, preferably to detect any breast lumps. MRI breast is now preferred, especially in high-risk screening, to avoid the risk of radiation of mammogram. And ideal period would be the first 10 days following the periods. Mammogram, especially for anybody looking for annual screening above 50. If you're above 35 and a strong family history also, and should be done every year, and more than 55 if they are asymptomatic, can switch over to every 2 years. Ovarian cancer screening, best thing which we can do is transvaginal scan, which is an internal scan almost done every year after menopause or every 2 years, where we apply color also to the flow and find out if there are any abnormal cysts. And we also do a CA125, which is a biochemical blood marker, which will tell us whether there is an increased risk of a cyst becoming malignant or cancerous. We have a software which diagnoses or gives us a number, which is called the risk of malignancy index. If the number is above 250, there is a 75% chance that particular mass or cyst which we are seeing on the scan could be cancerous. If it's less than 25, the chance is less than 3% or pretty much nil. If it's 25 to 250, it's a borderline risk of cancer. That is, if we screen 5 cysts, one of them could be becoming malignant. Are all lumps breast cancers? No. The mobile lumps, which are single, especially in a younger age group, can be just a fibroid. But if it's bigger in size and above the age of menopause, it could be a variant and could be a phyllodes tumor or a malignant change in the fibroid. If it's a firm lump with tethering or fixity to the skin wall or fixity to the chest wall, it could be a cancer or a fat necrosis. Most likely, it could be a cancer, and that needs biopsy. Self-breast examination, do not ignore any lump or node in the breast or in the armpit. Self-breast examination is a must and has to be done regularly. Above 40, get your mammogram done. Avoid smoking, excessive alcohol intake. Make sure you maintain an optimal weight and maintain regular physical activity so that these do not increase the risk factor. As we all know, obesity is the most important risk factor for breast cancer. What are the types of foods as far as lifestyle adaptation one can adapt to prevent breast cancer? Increase the antioxidants in your diet, increase fresh fruit and vegetables, increase your fiber in your diet. So flax seeds, pomegranate, pepper, ginger, seaweed, curcumin, garlic, green tea are some of these foodstuffs will provide the necessary antioxidants, flavonoids, as well as fiber in the diet, which tend to go to prevent breast cancer. Char grilled meat, barbecued meat, high fat containing meat. So some of these ovarian cancer are all cis ovarian cancer. We got two types of cysts. One is the functional cysts, which happen around the period cycle. They disappear if you re-examine them or re-scan them in 6 to 8 weeks' time. Whereas certain pathological cysts, like the dermoid cyst or the cystadenomas, where there are malignant tumors which can form, or chocolate cysts, which are very common, the reproductive age group, can also cause cysts in the ovaries. Moving on to genetic testing. There are people who would like to know whether they have a family, whether they are at high risk of developing a breast cancer or an ovarian cancer. We then offer them what is called hereditary cancer testing. And these are harbored in these two genes, the BRCA1 gene and the BRCA2 gene. Now, mutations in these two genes are known to affect the risk of breast cancer in the order of 30 to 50%. And a significant portion of breast cancer, which is hereditary, that is still unexplained. So we know that these mutations can cause both breast cancer as well as ovarian cancer. Let us see how it affects. If there was no gene mutation, there was only a 12% chance of ovarian cancer in the general population. If there is a BRCA1 gene mutation, then 55% risk of breast cancer in that population and nearly a 40% risk of ovarian cancer in that population. If it is a BRCA2 gene mutation, it's a 45% risk of breast cancer and nearly about 10 to 11% risk of ovarian cancer. So obviously, when you do the testing, you understand if there is BRCA1 gene, 1 in 2 can have breast cancer. That is a significant risk increase compared to 1 in 10, which is why in some of the clusters where there is a strong family history of breast cancer, this genetic testing can be recommended to understand how bad is the risk, and if so, what can be done prophylactically and prevent the onset of breast cancer. So who should get tested? Anyone with a first degree relative who has tested positive of BRCA mutation or with a strong family history of two and more blood relatives who have breast or ovarian CA, whose mother and daughter had cancer in both breasts. This is not an uncommon scenario. We do see them. Breast cancer diagnosed before the age of 45, before menopause. We also do some receptor status. It is for people who know about breast cancers that we look at the estrogen receptor, the progesterone receptor, so what we call ER/PR. So if they are triple negative breast cancer at a younger age, less than 60, when they have ovarian cancer or two or more types of cancer, the combination either being breast bowel, stomach, and ovarian cancer. If we have these combinations, then we check for BRCA gene. So if they are negative for both, we just ask them to do regular breast examination and have a proper healthy lifestyle. There are 4 components of a healthy lifestyle, which is called a holistic approach to lifestyle management. A proper, low-fat, well-balanced, high-fiber diet, regular physical activity of a maximum 45 to 1 hour every day, of moderate intensity. When I meet moderate intensity, if I am having a brisk walk, I should struggle to complete a sentence being short of breath. If I'm able to talk comfortably, I am not doing a moderate intensity activity. So 1 hour moderate intensity activity for at least 5 days a week. Keep your weight under control. Regular sleep of 7 to 8 hours and good management of stress. Reduce the alcohol intake and keep away from smoking. Screening mammograms, baseline above the age of 40 annually. That is very, very important. If they turn out to be positive, then surveillance screening is there, preventative medication, and prophylactic surgery. To quote somebody who's been a celebrity who underwent prophylactic surgery of removal of the breast, Mrs. Angelina Jolie, because of the positivity of these genetic mutations. So surveillance screening, it does not lower lifetime risk, but it definitely picks the cancer, which is earlier, and then makes it treatable or even curable, which is why we discuss mammogram and the MRI test. We have preventative medication. The goal itself is to reduce the risk of developing cancer. So tamoxifen can reduce the risk by about 50%, but can create an artificial menopause and has unpleasant side effects. Hormonal birth control for 5 years in the late 20s reduces the ovarian cancer. However, it can increase the breast cancer risk. So we do not recommend continuous intake of birth control pills as well. Prophylactic surgery for BRCA carriers, not for everybody else. If they have tested for BRCA positivity, then we recommend as removal of the breast or oophorectomy along with the tubes, especially above the age of 45. So who needs removal of the ovaries when they've had breast cancer? When they have tested positive for the genetic test, especially with premenopausal history, and they are above 45, we recommend removal of both the ovaries. When there is cancer spread to the ovaries, we do that. Or as an alternative in patients who cannot afford or tolerate the hormonal treatment which are given. So we do it laparoscopically. It's a keyhole procedure. It's a day case procedure. The answer to this is these ovaries are at risk of developing cancer or can stimulate the breast to develop further cancers, so which is why we remove the ovaries in this subset of patients. Moving on to endometrial carcinoma, which is the cancer in the body of the uterus, particularly in the postmenopausal women. It has definitely increased in the incidence in the recent years because of the growing pandemic of obesity. More the weight, more the risk of endometrial cancer. There are 2 types broadly. One, which is clearly linked to obesity and the hormonal body fat conversion, and approximately 4 in 5 women are related to this. But the other type is not got any relationship to the estrogen. These people are thinner, they're postmenopausal, it is a highly aggressive cancer. Risk factors for endometrial cancer. Anybody who has had periods much earlier, let's say 10, 11 years. One who has not had menopause beyond the age of 52. One who is infertile or never had pregnancies. Obesity, that is the most important risk factor. Treatment with tamoxifen for breast cancer for more than 10 years. Estrogen replacement therapy after menopause without any combating progesterone. High animal fat in the diet, especially barbecued or char-grilled meat. Diabetes, Western population, who have a family history of colonic cancer, or a personal history of breast or ovarian cancer. These are the risk factors for endometrial cancer. The red flag symptoms, do not ignore these symptoms. Even one episode, you should consult a gynecologist, get a scan done, get yourself thoroughly evaluated. COVID season, I have seen women who have not got to a consultation, either online, offline, irrespective of these symptoms, and have missed the boat of finding out the cancer early. That is something which should not be repeated. If you have vaginal bleeding after intercourse, if the bleeding is present between the period cycle, or even one single episode of bleeding after menopause, however little it might be, you need to consult a gynecologist. What will the gynecologist do? Do an examination, do a transvaginal or internal scan, do a sampling of the lining of the womb, which we call in the past as DNC. And for people with particular syndrome, we start screening them, irrespective of the symptom with endometrial cancer. We will screen them with biopsy from the age of 35 years. So if we are lucky to pick between clinical stage 1 and stage 2, treatment with surgery alone. Nowadays, we have robotic keyhole surgeries. Patient can be discharged on the same day, and the surgery itself is curative. If it is a high risk and we find it in a later stage of stage second B or 3 and C, then the patient will need radiation either to the vagina or to the entire tummy, and we can reduce the risk of spread of the cancer to the other organs. If we catch the patient in stage 1 and 2, the cure effective rate is about 75 to 90%. Unfortunately, if the cancer spread beyond the age of stage 3, the chance of survival drops down to 35 to 40% at the end of 5 years. So it is very, very important for us to have a strong suspicion, act quickly, diagnose quickly, and effectively cure the endometrial cancer, especially if they're presenting within the first 2 stages. Cervical cancer. This is again, as you can see, India, the chances of developing cervical cancer, it contributes nearly 1/4 of the cervical cancer in the world. So it makes the second common cancer as far as women are concerned in India. And this is the cervical cancer data as far as the women are concerned in India who die due to cervical cancer. The most important cervical cancer risk factor is unprotected intercourse, multiple sexual partners, and tobacco usage in any form. Many people do not know this. People think tobacco causes oral cancer or lung cancer. Tobacco can cause cancer in any organ, especially the bladder, especially the food pipe, the stomach, penis, as well as cervical cancer. In the West, whenever we see women, we tell them, if you are HPV infection positive, have an abnormality on pap smear, or a history of cervical cancer, we discourage smoking or ask them to quit smoking, because then the risk reduces. So multiple sexual partners, early marriage, when there is smoking, contraceptive pills, unprotected intercourse can all increase the risk of cervical cancer. The commonest reason why develop cervical cancer is HPV infection, and this is sexually transmitted, which is why we have various types which are low risk and high risk. High risk ones are the ones which cause cancer. We have primary prevention by vaccination. We have secondary prevention by screening, what we call pap smear, and then we have cancer treatment or palliative care. Again, we can prevent and detect cervical cancer much earlier, even before it becomes cancer, and treat it and eradicate it. But beyond stage 2, the chance of survival drops down to 20%. So this is how we test. We do a pap smear and a HPV DNA for all women above 30 years. If both are negative, we rescreen them in 5 years. If the HPV becomes positive, then we repeat the smear in 3 months after effective treatment, depending upon the severity and the abnormality, and then propose certain further tests. If they are not sexually active, we give them the HPV vaccination. The HPV vaccination is given between 13 to 26 years of age in 3 doses, and it offers 99% protection against cervical cancers. So if you have daughters, this is the best gift you can offer the next generation as far as cervical cancer prevention is concerned. Vulval cancer, last but not the least, is the cancer affecting the private parts, and it's very uncommon, contributing to only 4% of the malignancies which happen in women. It increases with age, more so after 60 years, and associated with immunosuppression or HPV infection. So HPV vaccination not only prevents cervical cancers, but also can prevent vulval cancers. It can be associated with a skin condition called lichen sclerosis, and the flat symptoms are excessive itching, soreness in the vulva, any burning sensation constantly when you pass urine, or burning sensation when they have intercourse. The risk factors I've already elaborated: chronic smoking, multiple sexual partners, obesity, uncontrolled diabetes, and having infection with HPV vaccine. We don't need to go into the details. This is a difficult cancer to treat, but if detected early, we can offer a complete cure and a good survival for more than 5 years. So in this presentation, we have tried and covered the ways we can detect and prevent breast cancer, ovarian cancer, uterine, cervical, and vulvar cancers. So the take-home message for people out there is, if you have a family history of breast cancer and ovarian cancer, do self-breast examination and go to your gynecologist for an annual checkup every year, not only for breast examination, for the appropriate screening methods, a pap smear to be done every 3 years, and an internal scan to be done at least every year, if not every 2 years. Postmenopausal bleeding, post-intercourse bleeding, bleeding between periods, vulval itching, dryness, and soreness should not be ignored, irrespective of whatever age you are. If we follow these norms, we will be able to not only prevent these cancers, but also detect them early and effectively cure them at a very early stage. So remember, most important 3 things: breast self-examination, pap smear, HPV vaccination, if not already done. Thank you. I'm happy to take questions now.
Yeah, ma'am. So thank you so much, ma'am. Actually, there were about almost 98 participants also. We almost at one point we reached. So thanks, ma'am,
Okay.
for elaborative presentation, starting from prevalence, causes, antioxidants, touching upon how many times people shy, and you just remove that shyness also, that this can be cured. That is the hope you have given to people. And even you
That's
touched
true.
upon the vaccination, what is available in an annual checkup, which is very vital for every woman. So this is a very needed topic for every
Yeah,
woman.
this is something I want to tell. Your annual checkup, your master health checkup in
Yes,
a woman is never
yes,
complete by just doing blood test.
understood.
Just don't give your bloods in a standalone laboratory and say, I've done your master health checkup. It is not complete unless you have a scan, unless you have some breast imaging, unless you have a uterus check, unless you have a pap smear done. People conveniently forget about this and just give bloods. That does not suffice for a master health check.
And there are some few questions, ma'am.
Sure, happy.
One of the question is like, madam, endometrial cancer, is there any vaccination?
Endometrial cancer doesn't have any vaccination. The only cancers which have vaccination is cervical cancer. But endometrial cancer can be detected early itself or even prevented. If you're known to have obesity, you can do some lifestyle intervention, reduce the obesity, keep your diabetes under control. And if you're at high risk, annually scan and screen so that you can prevent your endometrial cancer.
And the next question is followed by the same. Cervical cancer vaccination, can it be done after marriage?
It can be done even before the first pregnancy. It can be done at any age for that matter. As I said, it can be given to prevent both cervical and vulvar cancer. But The efficacy of the cervical cancer vaccine after marriage, after pregnancy declines to 70%, and you still need to have your pap smear done every 5 years. So pap smear is a must. But if you're given the cervical vaccine even before the age of marriage, it gives a much more greater protection. You still can have the vaccine, not a problem. But the benefit is much lesser.
Okay, ma'am. And the next question is from Mrs. Meera Suresh, Rotary Club of Adayar. What is the recommended age for the cervical cancer? That already madam has answered.
Yeah.
Do you recommend it for all women to
I
randomly
do.
get vaccinated?
You can, if you want, you can get vaccinated. Anybody of any age can get vaccinated. But the strong recommendation, whenever vaccination is done, it has to be in the immunization schedule. So we have a time limit by which the maximum efficacy is got. So 13 to 26 years is the best period to have it. But if you want to have it later also, there is no harm in having the vaccine. But the benefit of it will not be the same as when you had it in the younger age. You still need to get your pap smear done. Maybe not every 3 years, maybe every 5 years. That's the only difference. Hope I've answered that well.
And another question, ma'am. There are contradictory opinions that mammogram causes cancer. Is it
I'll
true?
explain. I'll explain. Now, the fear about mammogram is it is a form of radiation. We cannot subject young women, especially in the reproductive age group, to mammogram regularly, which is why I said if you're at high risk, say family history, your mother and aunt had breast cancer, and you are at high risk, and you need some form of screening right from the age of 25. So that patient should not be subjected to mammogram every year, which is why we have MRI. So frequent mammograms can potentially irradiate the chest and can cause the cancer risk, which is why younger patients we prefer MRI, older patients we prefer mammogram, especially high risk.
Okay, ma'am. And there is another question, probably not related to this topic, but it's a general gynec problem. Bleeding after DNC and setting up of IUD, is it normal? Bleeding after DNC and setting up of IUD, is it normal?
Bleeding after DNC can happen. And what do you mean by IUCD? If it is a copper related
Yeah,
IUCD,
I think probably I
if
think that
it's
one.
copper related IUCD itself can cause heavy bleeding. So we recommend something called Mirena, which is a hormone releasing IUCD, if the DNC was done in the first place for heavy bleeding. But if it's for contraception, either is okay.
Okay, ma'am. And there is another question from R. Lata. This is the person actually called me today morning. I think Facebook also we posted. So she was very much interested in following up with me for registration. So that much she was interested.
That's
There is
very
a
good.
question. That's a question. At the age above 50, in the stage of menopause, what screening test vaccination can be done?
Okay, good question. First screening test, breast examination by yourself after a period. By 50 to 52, you should start having menopausal symptoms. Do not worry if your periods become irregular, but you should not have heavy bleeding for more than a week, bleeding between periods, or continuous bleeding. If any of these are there, immediately visit your gynecologist. You should have a pap smear done, a mammogram done, your hormones checked, especially your thyroid and your follicle stimulating hormone, which we call the FSH, and your vitamin D levels, check for anemia, do an ultrasound of the abdomen and the uterus where you can see the uterus, ovaries, everything. That's pretty much it. So these are the tests you need to have when you're approaching menopause. Make sure you do not put on weight. Make sure you have regular exercise and eat a sensible diet and sleep well. So sleep disturbances can be a cause for stress problems as well. So these are the only tips for anybody approaching their 50s.
There is another question. If a sister is having a cancer, whether there is a risk for the other sisters also to have?
Yes. Depends on what cancer. There are 4 major cancers which have a strong tendency to occur in the family: breast, ovary, uterine, as well as colonic cancers. And in men, it's the prostate cancer. If these are there, there is a chance that the family members can also develop, which is why we ask any first degree blood relative has cancer. What we mean by first degree blood relative, mother's sisters, your own sister, these are all first degree blood relatives. If they are having breast cancer, it's a chance that other person can also develop breast cancer or uterine cancer.
Thank you, ma'am. And then there is another question. If improper breastfeeding done during lactation period, is there any chances of developing lumps? In future, can it develop into a cancer?
Uh, uh, we don't understand what you mean by improper breastfeeding. We recommend for everybody out there, we recommend 6 months exclusively breastfeeding for anybody. Beyond that is your choice. You can do well till whatever time, but we don't see much benefit beyond 1.5 years for the baby or for yourself. Second thing, the 6 months breastfeeding is a must from the baby point of view and the mother point of view. If that 6 months has not happened, this does not give the protection against breast cancer. Not that if you don't feed, you'll definitely get breast cancer. If you are breastfed, then the chances of developing breast cancer are lesser. Hope I've answered that question correctly. Second point, if you develop lumps during breastfeeding, these are basically collection of milk, what we call galactosine, or Tamil சொன்னா பால் கட்டி அப்படின்னு சொல்லுவாங்க. That does not become cancer, but can persist as lumps and it will take time to reduce its size. So they do not become cancer. These are because of collection of blocked milk in certain areas of the breast. It will take time to regress, but it will not become cancer. Hope that also answers the question.
There is another question. This is from a doctor actually, because we have population of doctor as well as general. This is Dr. Ujjwal Mukherjee from Durgapur, I think probably West Bengal. So would vaccine could be taken even in old age? If yes, what would be the dose? And how much will be the cost?
Vaccine, I do not recommend at a very old age because the cost is more than that of a pap smear. And I has already said it is 3 doses, which is given at 0 months, 2 months, and 6 months. And the vaccine doesn't have any side effects. But vaccine will not give the same benefit if it was taken before the age at first marriage. So you still need to have a pap smear. It is definitely costly because each vaccine, first one dose itself is more than 3,000, whereas pap smear will be only less than 1,000. Done in government, that also is for free. So the cost-wise, it is not cost effective, but can be taken. There's no harm in taking. It will not say offer the same benefit proportion what it would offer if it was taken earlier at an age.
And there is another question, ma'am. I think this is related to that breastfeeding only. What about lumps created by tissues? Why does that happen?
You mean fibroadenoma? These are so. Collection of fibrous or what we call fibroid type tissue, like what happens to the uterus in the breast fat tissue. Breast is nothing but fat and connective tissue. There's nothing else there. So when this happens, they can become mobile lumps called fibroadenomas. We do not recommend removal of all fibroadenomas. We recommend monitoring of the fibroadenomas. So you have to have your scan done every 6 months to 1 year. And
will this change to cancer also, ma'am? Will this?
Not necessarily, but fibroids or so-called fibroids in older age group can become what is called Phyllodes tumor. This Phyllodes tumor, if they are left there, they can become cancerous. So we recommend removal if there is a suspicion of Phyllodes tumor. You would have seen in the PowerPoint, especially if the margins are negative, they won't become cancer after that, or you don't need to remove the breast. You just need to remove that lump.
Okay, ma'am. Almost the questions are over. So very terrific response, immense response. In fact, some of the patients also called in the morning. We felt very happy. It is a very needy topic for many needed people today in this scenario.
That's true. That's true.
Yes, ma'am. And many people feel shy to open it up, and probably you have given a better clarity today, ma'am. So
definitely.
Thank you so much, ma'am, for coming
welcome.
and giving us.
Thank you.
Okay, ma'am. Thank you.
Thanks a lot. Thank you. Have a good day.
Yeah, ma'am.